For picking up cancers early, or what we call as a screening methodology, we need to have patients who have high incidence of cancer. So for that reason, we have only 3 cancers for which screening is approved in our country. For breast cancer, we usually do screening with a mammogram. So mammogram is a type of X-ray where we usually do the X-ray of the breast, and it's usually started at the age of 40 years, and then later it has to be followed every year or 2 yearly based on the baseline mammogram. For cervical cancers, we have something called as a pap smear, which we are combining with the liquid based cytology test, and we usually do the pap smear every 2 to 3 years from the age of 21 years or onset of the sexual activity. For colon cancers, we have colonoscopy, so where we usually visualize the entire colon with the colonoscope, and it's usually started at the age of 50 years, and we do it every 10 years from there onwards. So we have only 3 cancers which can be picked up by screening for the general population. In men, for prostate cancers, at times we screen with a PSA, but again that's with the consent, and we need to explain them both the risk and benefit. The other cancer where we usually are offering screening is lung cancer. If some person is a heavy smoker who has packed 20 pack years or more, we can do a CT scan of the chest to see where any early lesion can be picked up. So again, it's an annual CT scan for screening the lung cancer. So if we are doing for the regular general population, it's for the woman with a mammogram for breast cancer, pap smear for the cervical cancer, colonoscopy for both men and women at the age 50 and above. Only for smokers we do with a CT chest for lung cancer. So these are the screening tests which are approved.